Hey, it's Tamara from Acupuncturist, and this is my first ever Facebook Live for Acupuncturist, and I'm super excited. So I hope some of you will join me today to ask your questions, get some answers about acupuncture. I was really excited because this past week, Roy Wasabi, who has the YouTube channel called Guava Juice, came to my clinic and recorded a video of him getting acupuncture for the first time. And that video has about 1.8 million views right now, which is amazing because it's mostly children who are watching the video, and it's such a special and unique opportunity and chance to show children acupuncture. So that's been amazing. It's been a really cool opportunity to do that. And a lot of the kids, I'm gonna have some tea. This tea I made from the roses and the lemon verbena and the lavender from our garden, which is really good. It smells really good. A lot of the responses that I've been getting from the video are from children. In fact, I've been getting messages from around the world from kids asking me what acupuncture actually is. So today is a chance for us to talk a little bit about what acupuncture is and how it works and what it feels like and how it can help you. So yeah, lots of kids have asked just the simple question, what is acupuncture? Acupuncture is very, very old medicine that originally comes from China. And people think that maybe about 4,000 years ago, people were starting to do acupuncture. And about 2,000 years ago are the first books that we have about acupuncture. And acupuncture, you know, we're not exactly sure how all of it came into being, whether it was experimentation or people, you know, doing a dissection or things like that. But over time, different systems were developed, and acupuncture helps amazing amount of different things in the body. So basically, it's a very old medicine that balances out your hormones. There's these little chemicals that happen naturally in your body, and they help you with your endorphins that help you to feel good. And balancing all those things out really, hi Kathy, hi Anna, nice to see you guys. So we're just talking about what acupuncture is, because I've been getting questions from around the world about what acupuncture actually is. And I'm trying to see how I can see everybody else that's here, but right now I just see Anna and Kathy. Let's see. Hi Akasha, hi everybody. So acupuncture is, like I was saying, thousands of years old. And basically acupuncture involves taking little tiny needles. They're so tiny. They're like a little bit thicker than one of your human hairs. I mean, take a look at your hair. It is just so thin, right? And that's what our acupuncture needles actually are like. And so when you put them in the skin, you hardly feel anything at all. It's pretty cool. In fact, I'm going to grab one so you can see what it looks like. So here's a little package, so you can see that they're sealed, and that keeps them sterile so that it's safe for you to use and you don't get any chance of infection or anything like that. So I'm going to open up this package, and so this right here is has a little tube, and I open that up, and this is my guide tube, and that's just a little plastic tube, so a lot of people will feel that first, but I don't even know if you can see it. See the blue part? That's the handle, and the needle is actually, let's see if I can get any closer. Can you see it? It's just like a little tiny hair, tiny. And if I'll just show you on myself, if I put that in there, let me use the guide tube. 1 second. It's hard to see. It's so little that I can't even get it into the guide tube because I'm a little light. There we go. Sorry. All right, so I'm just gonna tap that in right there. So just a little tap, and so basically all you can really see of it is the handle, and you can kind of see the little bit of the glint of the needle. It doesn't hurt at all. I didn't feel it even a little bit. So acupuncture uses these little tiny needles, and we put them in specific points all over the body, and it could be to stimulate a nerve, it could be to stimulate a muscle, it could be to help stimulate nerves. It works really well for things like someone has had a stroke or any kind of epilepsy or paraplegia where they can't move their body. So that's pretty cool. Do we have any questions? It's hard to see. Any questions yet? Can someone just say hi, just so or like type in something so that I can see if it's working? That would be awesome. Anybody? Hello? Let's see. Uh-oh. I'm not seeing questions again. Oh, there it is. Hello. Hi, Kathy. Thank you for helping me so that I can see if everything's actually working. That's great. Hi, Beth. Hi, Anna. I'm trying to, stabilize this. It's like I have the phone mounted to the wall. Hi, Jennifer. Haven't seen you in a long time. Beth, yeah, you always wondered how big the needles were. Did you see the demonstration that I just showed you? I do use electricity sometimes. So this is the needle. So what you're seeing is the blue part is the handle, and there's the needle is so thin, like just a little bit bigger than a human hair, that you can hardly even see it. So if I'm going to add electricity to that, which does help to give you even more stimulation, I'll show you what I use. So I use this little portable machine, and I can change the frequency and the power on the electricity, and I attach the little tiny electrodes to the needles, and it sounds a little scary, but it actually feels great. It's just a little tingling sensation, and we can adjust it so that it isn't painful, and that really helps to stimulate the needles. It kind of does the job. Sometimes we'll sit there and turn a needle with our fingers, but the electricity will do that for us. So that's a really great question. Anybody else have any questions that you're dying to get answered? Hello. All right, I'm gonna have a sip of my tea. I made tea from stuff from our garden. We have some lemon verbena and some rose petals. Kathy, yeah, it is kind of like a TENS unit. It's a little bit different with the frequencies and the way that we can modulate them, but yes, it's very similar to a TENS unit. And I do use TENS as well. So I make, like, you put a patch on someone's back, and the TENS will contract the muscle like that. But these actually will attach directly to the needle so that the electricity will be conducted through the needle. How do you determine where, Beth says, how do you determine where a needle would be placed to help a certain ailment? So that's where studying comes in. And let me see, hold on one second. I'm gonna show you my little friend here. So you have a whole lot of, these are all acupuncture points. You have a ton of acupuncture points all over the body, and they all do different things. And so we study, if you can kind of see in here, there's almost little lines. So you can see the dots are the points, and the lines are called channels or meridians. And we, our books say that these meridians are kind of invisible pathways through the body, which sounds a little airy-fairy, but we're actually learning more and more that what these may be is actually connective tissue or fascia. Fascia is the kind of sheath that goes over the muscles and through the body that sort of encapsulates certain areas. So we think that maybe through the fascia system, and then also through nerves and nerve conduction. Like if I treat these needles on the back, if I treat up here, it's going to help the lungs. And if I treat down here on the hand, it may come up and help the neck. And that's because there's nerves running and innervating the plate from the back to the lungs, or from the hand to the neck. So we're addressing the issues because of where the fascia is, where the nerves are, And so we've learned how these different pathways communicate with each other, and sometimes it doesn't look like it makes sense. We might have a patient on the table say, well, why are you putting a needle in my foot when my low back is hurting? And so I will put, and it's because your low back actually goes and innervates your foot. And so we can needle in your foot to help your low back. Does that make sense? Hi, Jessica. How are you doing? Good to see you. Have some more tea. So that's one of the ways. The other way is we use something called ashi points. So ashi points almost sounds like, ah, shoot. So you would, I will press and I will check on the body, and I will see where something feels tender or where it almost feels like there's like a little bit of a dip. And I will put a needle there and in these ashi points. And so just to kind of, it may be because of where there's pain, it might be that things are kind of stuck there, that the fibers of the muscle are stuck, that there's some irritation or inflammation. And so I will put a needle directly into that area that's tender, that might not be a traditional point, and that will help to relieve some of the local pain. Anybody else have some questions? Hello out there in Facebook land. It's good to see you. I hope everybody's enjoying your Sunday, having a good day. So I'll talk a little bit about, I was just saying before a lot of you came in the room, I just had this amazing opportunity to treat Roy Wasabi, who has a YouTube channel called Guava Juice. And I will come back to you guys in 1 second. So the video of me giving Roy Wasabi acupuncture has now almost 1.8 million hits, and I've been getting messages from kids all around the world asking about acupuncture. So I thought tonight would be a good way to help give them some more information. Akasha says, what can acupuncture do for mental health? It's a fantastic question, and it's one of the areas that I really love to treat. So acupuncture works for mental health in a couple of ways. One, it addresses our parasympathetic nervous system. And what that is, you might have heard of your fight or flight. Fight or flight is like when you have adrenaline in your system and you feel like you're angry and you're gonna, you get all balled up and you feel stressed out and in anxiety. The opposite, and that's your sympathetic nervous system. The opposite of your sympathetic nervous system is your parasympathetic nervous system, and that is what we call rest and digest. So when we use acupuncture, it actually stimulates the rest and digest, the parasympathetic nervous system. So it allows the endorphins, it allows chemicals that like serotonin and dopamine to circulate through the body and to help you to feel more balanced. So it can help with anxiety, it can help with depression. It can help people to feel more calm if they're feeling manic, and kind of bring them up if they're feeling depressed. I often have people come to my clinic about once a week, just like they would go to therapy, and they'll come here in addition to therapy to get some acupuncture and perhaps herbs to help to balance out those hormones and brain chemicals, to help them feel a little more balanced and be able to kind of take the edge off and help them to move through the world with more ease and calm. Let's see. So I hope that answered your question, Akasha, and certainly if you have more questions, go ahead and I can be more specific. Let's see. Daith piercing. Yes, I am familiar with it. That's not something that I do specifically. I do migraine treatments, would be just regular traditional acupuncture. And we do auricular acupuncture, which is needles in the ear that are either come out or that they're little tiny ones like stickers, and you would keep those in your ear for perhaps a few days, or else a little tiny seed, actually. They're radish seeds, so my radish is pretty timely, but so that will go on the ear and you will be able to stimulate those points. I hope that answered that question. But we don't do any more intense piercing or anything like that. Cosmetic acupuncture that's a great question. So cosmetic acupuncture is very up and coming. The reason that cosmetic acupuncture is helpful, and it'll never give you the same results as getting plastic surgery or something like that, but cosmetic acupuncture works by stimulating collagen and elastin, which are the proteins in your skin that help to keep them feeling kind of plump and firm. And it also can help modulate some melanin, which is what causes discoloration, which is something I have a little bit on my cheeks. So when we do cosmetic acupuncture, we will pull up the skin and almost kind of tack it, not that severely, but like with the needles in place, and we needle right into wrinkle areas or discoloration areas, and that will help to stimulate more collagen and elastin production. And I also do some facial massage. I will do some gua sha. I'll show you a tool that I use for that. So I might use this jade gua sha tool to just stimulate the face. And I also might add in some facial cupping. Let me show you 1 second. I'll grab one of those. So the facial cups are applied to, I'll just see it's stuck there, and it doesn't make a mark like the way that cupping does on your back. And these I will actually slide on the skin to kind of enhance the contours and to help sort of sculpt the face. And I will use that in conjunction with cups and also with some jade rolling. And I like to use sea buckthorn oil at the end to help people. It really helps to nourish the skin. It helps with discoloration and wrinkles, and it's a very lovely protective oil. I like it a lot. It actually helps with acne as well. And we can do cosmetic acupuncture for acne to help with acne cysts and with scarring as well. Did I get everybody's question? Hi, Jen. How are you? Gina, did I say hi? Hi, Gina. Who has more questions? More questions. So I'll show you guys something while we're waiting for more questions. Hi. A really new tool that we have, and it has the studies about it are coming out are actually pretty amazing. What's great is that the studies are easier to conduct than with traditional acupuncture because you can just use a plain light as your control, and that allows you to have really good data on whether as far as placebo effect. How often do you recommend treatments take place, says Beth? So it really depends. If you have an acute injury, something that is, you've been hurt, you're extremely ill, you have a chronic thing that you need to work on, it may be once a week. Sometimes with really intense things, it could be a couple days in a row. For fertility patients, I like to see them once a week, or even better, twice a week. But I know that sometimes finances don't work to be able to support that. So, once a week in the beginning is great, and then perhaps once a month, just to kind of keep things going. And then when people are really gotten into a state of balance, I like to treat seasonally. So just a good reminder is that at the beginning of each season to come in for a treatment, so 4 times a year. Gina says, would this be helpful in reducing inflammation for a person with severe asthma? Yes, absolutely. Studies are really great about how acupuncture works on inflammation. It actually does help to reduce the number of mast cells in the body, and those do contribute to your asthma and your inflammation. So acupuncture has really been quite effective for asthma, as well as cupping on the back. I've seen some really good results in cupping on the back to stimulate the lungs and help clear things out there. In Chinese medicine, we talk about the lungs and the skin being connected, and we know what our lungs are. Do kind of breathe in a way. So, opening up the skin in the back and in the lung, the area that innervates the lung with cups really does help as well. So both needles, cupping, and then there's plenty of really great herbs and classical herbal formulas that do help with asthma. So I hope that answers that question. Feel free to ask more detail if you need more. Jen's asking if I've watched the YouTube video of me and Roy wasabi a guava juice yet, and no, I haven't. I'm too nervous. I've watched sort of little clippets of it. Clippets, is that a word? Little clips here and there, just because I'm checking the numbers, or I'm checking to get a still frame. But other than that, I haven't looked. So I hope it was okay. So I was going to show you laser acupuncture. So laser acupuncture, like I said, is amazing because it's painless. It seems to be very effective. It does take me a little bit longer to do it because I have to hold it point by point. But it's great for, I've done it on babies, and it's really, really cool. And I'll just show you. You can kind of see the light there. So you're not supposed to look at the light, but literally I'm just holding the tool on an acupuncture point by point. I like to combine it with traditional acupuncture, but thank you, Jen. I'm glad you liked it. I like to combine laser with traditional acupuncture, but especially for babies and kids, and people that are really elderly or weak, if people with advanced cancer, advanced HIV, elderly folks that have very thin skin, the laser acupuncture is really a great option because it doesn't pierce the skin, and it's still very effective and as well as being gentle. Hi, Amy. How are you doing? Good to see you. I'm going to have a sip of my tea. I hope you guys have a beverage as well. Maybe a little Sunday mimosa or tea as well. Any questions? Hey, Amy, do you have any questions for me? What made me decide to become an acupuncturist? Good. That's a good question. I have a genetic disorder called mitochondrial myopathy. So mitochondria are the little powerhouses in your cell that process energy. Oh, there we go. We got two people asking the same question. So you have mitochondria kind of everywhere, and my muscles sometimes take longer to heal, to process, and they can get a little bit weak. It can also affect other parts of my body as well. And I did get very sick many years ago, and so sick that I was losing consciousness, that I was having trouble swallowing, trouble seeing, trouble walking, and trouble using my hands. Oh, happy to see you too, Amy. So it got pretty desperate. And all of Western medicine was actually making me sicker, because what I didn't know at the time that I had the mitochondrial disorder, and a lot of Western medicines don't work for mitochondrial disorders because it just gives the mitochondria more to process, and so you can actually get worse. And a friend suggested that I get acupuncture, and I was skeptical. But I needed help kind of going into the clinic, and when I was on the table, I could barely sit up by myself. My hands were white. I had like no circulation, no feeling, and I actually watched the color come back into my hands on the table, and I was able to sit up at the end, and within a few days I was taking steps, and between acupuncture and herbs, it completely changed my life, and it made me able to function. And I still do have flare-ups from now and again, and it can be harder for me if I get a cold or whatever, but with acupuncture and herbs, it really greatly enhances my health and my ability to function, so much so that I was able to finish graduate school and to be take the state licensing boards and start my own clinic. So it's been awesome to be able to share this with other people, because I know it works. It's worked for me. I've seen it work for my patients. I've seen people with strokes who have not been able to move their hands start to be able to move. I've seen people who haven't been able to get pregnant. Just amazing results, really. People that have been in pain for a long time finally being able to move and to be comfortable in their bodies. People that have high anxiety finally being able to feel like they can go out into the world. And that's why I do this work, is to be able to help other people to feel comfortable, to feel pain relieved, and it works really well on things that Western medicine often throws their hands up and says, I don't know what to do about it. So it's great. It's a really amazing modality, especially because it really doesn't have any side effects. You can do it. It's very, very safe, and you don't have to worry about the side effects that you would get from medication. Beth, since I don't live near you guys, what do I do for an acupuncturist? So absolutely, I would say, first of all, make sure that they're board licensed in your state, and then I would ask around, ask people who they like and who that they think is good, and call and talk to those people. You should find an acupuncturist who is a good match for you. So everybody has a different style, as far as acupuncturists and patients. So find somebody that you like. Find somebody that you can communicate well with. Find somebody that is going to know about your issues. But the communication really is the biggest. If you can communicate with your acupuncturist, if you feel safe to talk to them, to tell them what's going on with you, if you feel like they're listening, that's a big help. So I would definitely find somebody who does that, and then and ask around. You know, definitely check Yelp, but not just Yelp. Ask people for direct recommendations, and then I would call those practitioners and have a chat with them before you come in, for sure. Hi, Carrie. How are you? Carrie Ann. Carrie Ann, do you have any questions for me? I know you just walked in the room. Walked in the room. No problem, Beth, and thank you. Yeah, I appreciate any referrals that you guys have. So this is kind of funny. One of the things that was a big hit on the guava juice YouTube video was Harry, my hedgehog. I think, like, I don't know, hundreds of the comments, thousands of the comments are kids saying, "Yay, Harry!" and they're all like, Team Harry. Harry's the leader. So Harry here is my little guy that I use for babies and kids, or YouTube stars, as the case may be. And what I will do, babies might just want to hold it and pet it while they're getting a treatment. Kids can hold it, but what I also do with kids is have them pretend to do acupuncture on it. So do like a role-playing thing. Let me see what I have. Like, I might give them, so for babies and kids, I do something called shonishin, which is a Japanese style of needleless acupuncture. And I might roll along a certain meridian or press into a point. So I might give them this tool, and they can do that to Harry before I do it. And I might show them, like a little fake needle, like a little toothpick or something like that, and they can do that for Harry before we start. And it really helps them to feel calm and to kind of understand the procedure a little bit better. And of course, babies and kids can sit in their parents' arms while they're having the treatment done. And it's very quick for children. It's just in and out. They don't even feel it. And the pediatric needles I use are just impossibly small. And I also do use the laser for kids as well. And another thing I do use for children is toys that help them relax. So I might use like a glitter wand so they can take deep breaths and kind of watch the glitter. Or what else do I have? Let's see. One of these little water wheels. And they're just relaxing toys that can kind of help them get into a state where they're just concentrating there and just peacefully breathing. You're a doula. How does that relate to acupuncture? Good question. So I've been a doula since 1998, and a doula is somebody that helps a mom and a family during childbirth, and give support, either physical support, massage, helping them change position, and helping them communicate during the birth process. I do specialize in birth because like I have said, I've been a doula since 1998. I've been a childbirth educator since then, and I've also was a former Leche Leg leader, which helps with breastfeeding. As a doula, which I absolutely love, and I'm a mother of 4, so I've given birth naturally 4 times, both at home and in the hospital. With that kind of background and that experience, what I've been able to do is kind of translate that into acupuncture. So acupuncture is great, for fertility, for first getting pregnant. And then during your pregnancy, it's really effective for morning sickness. It's effective for aches and pains, low back pain, heartburn, things like that, insomnia that you get during pregnancy. Also, I do treat threatened miscarriages, which is where it looks like the baby, you might be losing the baby or having some bleeding. So I will help with helping you to stay pregnant. If it does seem to be a viable fetus. But it also, through the pregnancy, I do birth preparation in the last month, where I will do needles, I will do positioning, so I will kind of help the baby to get in the right position by doing certain exercises with the mom. And I will do something called moxibustion, which I actually have here. So this is rolled up mugwort herb. And mugwort is this amazing, smell it. Oh, it smells incredible. It's like this heady, intense, minty goodness. And we burn this near the low back for moms who are about a month within their due date. And what it does is there's a lot of bioactive components in here that actually we think address the nerves in the low back and actually start to relax the pelvis so the baby can get into the right position, and it really helps to have a more optimal birth. So I'll do that. I have amazing pillows that your breasts and big belly can fit in, so you can actually lay face down, which is great. Feels awesome when you're pregnant. And I will do all that birth preparation, also turning breech babies into the right position. And it helps I can also do more aggressive treatment when you're ready to start encouraging labor to come on. And that's very effective. And I can also help with pain relief during, as a doula, I can use acupuncture to help with pain relief and to help contractions to actually be more strong and more effective when it's important for them to be more strong and more effective if the baby's in distress or something like that, and to help make the pushing phase more easier. FYI, the feed will sometimes freeze. Oh, sorry. I hope that's not happening a lot. It looks clear over here. Let me know if it happens again. Let's see. So yeah, so I do doula work. I do custom packages. People can come, you know, just for birth preparation. They can come to have a breech baby turned. They can come to help their labor to be more effective, or they can get a full package where I'm with them 24 hours or as long as it takes for the baby to be born. Let's talk about migraines and nerve pains. And Carrie Ann says, what is about putting needles into the body that affects it so positively and relieves pain for issues that aren't able to be resolved by modern meds and Western medicine. So those kind of actually go together. So we'll talk about that. So with migraines and nerve pain, again, we're talking about those are usually neurological issues or nerve issues. The nerve pain can be compression, so it could be that there's bone compression on a nerve, or it could be that there's inflammation of the muscle that's compressing a nerve. And with migraines, these are neurological issues. Again, we're working with brain chemicals, serotonin and dopamine and adrenaline and all that good stuff, estrogen and testosterone and all the things that can be balanced out with the needles that will address the migraine issues. So we address it both physically by working on the muscles and the nerves, and then also putting them in places that are going to help to balance your brain chemicals and hormones. Let me just reread that again. So for issues that aren't able to be addressed by Western medicine, the thing about Western medicine, and I love Western medicine, I think it's amazing. I think science is amazing. I'm so glad that we have Western medicine as an option for when we really need it. Western medicine is good at really specific things. It's great for surgery. It's great for real emergency situations. But Western medicine doesn't often take the time to look to see how everything is connected in the body, or how issues are connected, how our mind and our thoughts are connected to our body. They often aren't looking at our lifestyle. And so Chinese medicine allows us to look at the connection between mind, body, lifestyle, diet, whether our stomach is affecting our lungs. I know for myself, when I was in the hospital, a few years ago when I was quite sick, I couldn't get, I went in for one thing and I was having another problem, and I couldn't get another doctor to come look at me because they said I had signed in under a certain diagnosis. And I was like, what? But they're, connected. There's two things going on. So Chinese medicine gives us a chance to look at those connections and to treat all of it systemically. And sometimes that approach is more effective. As well as herbs are amazing, because Western medicine is often just one active ingredient, and we kind of just go in and kind of, this nuclear option. But with herbs, we have balanced formulas that are a combination of different substances, and they balance each other out really beautifully, and they work together synergistically, which means they help each other. So herbal formulas can actually nourish the body and not have the kind of side effects as Western medicine, and they kind of work, again, systemically. So those are ways that acupuncture and herbs can work differently than Western medicine. So balancing hormones, balancing chemicals, stimulating nerves, reducing inflammation in the body, all that good stuff. Does that make sense? Sorry, it's a lot of information, but it is question answer. That's why we're here tonight. Hello everyone. Let's see what else I have. Any goodies to show you? See, we talked about facial. Oh, cupping. Cupping is also a really. Bye, Kathy. Have a great night. I'm gonna try to do. Yeah, I'll try to do some more live casts. Maybe once a month. More people are interested, and we seem to get more views. Have a great night. I'm going to. Oh, can somebody tell me what time it is? For some reason, I can't see the time on my phone while I'm live casting. I'm gonna grab. Let's see my cupping set. So another really great part of Chinese medicine is cupping. Oh, 5:36. Well, we're actually over 5:30. All right, so I'll show you. Thank you. So I'm going to show you guys this, and then I think we'll sign out for the night. So cupping happens all around the world. It's a brilliant modality that happens in the Middle East, Asia, Africa. It's either glass cups have been used, bamboo cups. I use plastic because I can control the suction on them a lot easier. And what these do is help to kind of pull some of the lactic acid, built up acid in the muscles up and out, and then reinfuse it with fresh blood and kind of bring more circulation to the area. So it's extremely beneficial for chronic tightness and pain in the body, as well as common cold. When you have a fever coming on, it literally brings the blood up to the surface and cools it. So it helps to reduce fever like that. So I just use a little pump, and it's hard, and it looks a little funny, and I'll pump it up like that, and you can kind of see there. And so I'm looking for discoloration. Sometimes if people have a lot of stuck muscle, blood, a lot of acid in the muscle, it will turn really, really dark. And you've seen that maybe with swimmers, like Michael Phelps and Olympic swimmers. You see it down their back. It looks like they've lost a fight with an octopus. And so this is actually one of my favorite modalities. I love the way it feels. It's different than a massage where you're pushing in because you're actually pulling up. It feels fantastic, and it really does help with deep chronic injury. Hi, James. Nice to see you. Should I keep, like more people are coming in. I know it's been over half an hour. I don't know if I should keep going or if I should sign out. I'll give you, if you guys want, I'll take the phone off and I'll give you a quick tour of the clinic if you haven't seen it before. Let's see, I get it. Let's see, here's my intake area. You'll see there's my little notes. Got a fountain. I take blood pressure here. There's my little, this is, let's see, it's hard, let me do it this way. Over here is where I keep my herbs. I've got liniments. This is a pediatric formula for lungs. This one is actually right here, Shinyasan, is for if you're having like runny nose or sinusitis, something like that. I keep tea. I like to give everyone tea and water afterwards. Definitely have the hand washing station. I keep my needles here, take temperature. This is a little place where I can see what time I put the needles in and look at the count, how much, how many needles are in. Here's the bed. Again, I can't tell what you can see. There we go. I keep bolsters over there. I like to sometimes wake people up with a oops, I guess we lost signal. Anyway, so this is my clinic space. I'll just kind of go around in a circle here. And it's super cozy. And I would love to see you guys in here. Let folks know that they can make an appointment at Acupuncturist. It's www.acupuncturist.com. And I hope to see you guys in the future. Hope this was helpful and answered some questions. And stay healthy. Have a lovely rest of your Sunday. And I hope you guys have a great week. Talk to you later. Bye-bye.